How can you accept limits that don't have to be there, he said. Biotechnology could mean an end to aging. It could even mean an end to death itself. And that's when it came out. But what's wrong with dying, I said.
Euthanasia is defined as the painless killing of a patient suffering from an incurable and painful disease or in an irreversible coma. Euthanasia, although illegal, is commonly reviewed and discussed now more than ever before. There is some evidence that it is much harder to anticipate one's state of mind when dying. It's difficult for a healthy person to adequately imagine what they would really want in the situations where a living will would take effect. A living will is a document that sets out a patient's wishes regarding health care and how they want to be treated if they become seriously ill and unable to make or communicate their own choices. Euthanasia affects other people's rights, not just those of the patient, meaning it hurts more than one life. Problems regulating euthanasia comes up in many of these arguments, where it can be difficult to deal with people who want to implement euthanasia for selfish reasons or pressurize vulnerable patients into dying.
Historically, the law often reflected these views, although in the United States no states now criminalize suicide or attempted suicide, but a majority prohibit assisting in suicide. While in nearly all countries, neither professional practice nor the law permits physicians to grant patients' requests for physician-assisted suicide or voluntary euthanasia. Some laws say that terminal condition is expected death in a relatively short period of time. Others claim terminal means death is expected within 6 months or less.
The highest court in the land today. Paul Lamb, who has no function in any of his limbs apart from a little movement in his right hand, has joined the action brought by Jane Nicklinson, whose husband Tony died last year. They want the blanket ban on assisted suicide changed to allow some seriously disabled people a humane and
Hopeless
dignified
condition
death.
is also defined as terminally ill, and euthanasia activists replace with other phrases such as hopelessly ill, incurably ill, and meaningless life.
Those who have intense psychological or physical pain are considered terminally ill.
Almost all societies, even non-religious ones, for thousands of years have made euthanasia a crime.
Euthanasia is against the law in the UK, where it is illegal to help anyone kill themselves. Voluntary euthanasia or assisted suicide can lead to imprisonment up to 14 years. The Netherlands has the most liberal assisted suicide laws in the world. Under Dutch law, doctors can administer a lethal dose of muscle relaxants and sedatives to terminally ill patients at a patient's request. In the 1960s and 1970s, it was common to distinguish between active and passive euthanasia. Passive euthanasia was understood to include foregoing life-sustaining treatment, either by stopping it or not starting it. Active euthanasia was understood to be a deliberate intervention to end a patient's life, for example, by administering a lethal injection.
Some surveys in the USA and the Netherlands show that less than a third of requests for euthanasia were because of severe pain. Life-sustaining treatment debates in the United States during the 1970s and 1980s often focused on the use of cardiopulmonary resuscitation, CPR, for persons who suffer cardiac or pulmonary
some states are thinking about. For example, the right to die is already law, if you want to call it that, in the state of Oregon, in Washington. 3 or 4 other states have variations of it. A very famous Supreme Court decision called Gonzalez against Oregon gave the state of Oregon the right to have people access voluntarily, emphasize that, voluntarily, to have somebody assist them in their end of life.
In 2003, in the United States, physician-assisted suicide is legal in the state of Oregon, and that state's accumulating experience with the practice is the basis for considerable debate. In terms of patient security, psychological and emotional pressures commonly overpower depressed or dependent individuals.
You can imagine quite how it feels to know that the one thing that the person you love wants, you can't give it to them. for legal reasons. People have said to me, well, why didn't I just go ahead and end his life for him? But he would never have let me, knowing that I would, risk life in prison.
Living wills were first proposed in 1969 by the American lawyer Louise Kuttner as a simple device to allow patients to say no to life-sustaining treatment that they did not want, even if they were too ill to communicate.
Life-sustaining treatment debates in the United States during the 1970s and 1980s often focused on the use of cardiopulmonary resuscitation, CPR, for persons who suffer cardiac or pulmonary arrest.
If law cannot help us, I will take the law in my hand. I will kill her, I will go to the gallows.
Euthanasia is not the same thing as refusing burdensome medical treatment. Refusing such treatment can be seen as allowing the dying to die in an appropriate way, which is not the same thing as causing the death of a living.
Britain's religious leaders claim that 1 in every 32 deaths in the Netherlands is a result of legal or illegal euthanasia. In January 2005, a report in the Dutch Journal of Medicine alleged that there had been 22 cases of illegal euthanasia involving infants born with spina bifida. Moving into moral aspects, legalized euthanasia would most likely progress to the stage where people, at a certain point, would be expected to volunteer to be killed. The movement from voluntary to involuntary euthanasia would be like the movement of abortion. Many believe that euthanasia could be abused and used as a cover for murder. Competent patients have the right to weigh the benefits and burdens of alternative treatment, including the option of no treatment, and to make their own selection. A number of ethical grounds support the common practice, employed by physicians and sanctioned by the courts, of turning to a close family member of the patient when available. In situations in which the patient is not able to give informed consent for treatment, and there is no guardian and no advance directive, some 44 states have default surrogate consent laws. Formerly known as the family consent laws, these laws generally provide a hierarchy of authorized family decision-makers who, in descending order starting from the spouse, can make medical treatment decisions on someone's behalf. For our interviews, we decided to interview 3 nurses who in their professional life have dealt with patients by assisted living means. These nurses have wished to remain anonymous. All 3 of our interviewees are registered nurses. Our first nurse believes its purpose is to end life in a dignified and peaceful manner so that there is no suffering involved by either the patient or the family member. Our second nurse has mixed feelings about euthanasia, and they feel that it should be used for people who are terminally ill, who are suffering, and or families that are suffering. Our third nurse believes the purpose of euthanasia is to give a patient control over the end of their life in painful and terminally ill situations. One believes this should be available to those of sound mind who are suffering physically with a long drawn-out illness. The second nurse wasn't so sure about her answer. She believes, quote, patients would have to meet specific criteria. Our third nurse believes euthanasia should be offered to those terminally ill people who do not want themselves to suffer or their loved ones to have to see them suffer. To nurse number 1, those who are not of sound mind cannot make decisions for themselves. To her, this is unethical. The second says that they've met many people over their career whose medical situation was at an all-time low and have no idea how to care for themselves. The third nurse agreed that she in her lifetime have seen many patients who are incapable of making this decision on their own. The first believes that these would be very overused. Very specific criteria would need to be enforced in order to uphold this. Our second nurse believes it'd be a very slippery slope and would be hard to follow specific regulations in the nurse community. Our third nurse agreed, being concerned about the misuse of euthanasia. She believes that it'd be very heavily regulated as well. First nurse quoted, yes, many times I work with elderly patients who suffered physically and emotionally. They felt like they had no quality of life. In similarity, our second nurse said most of these people did not consider ending their life, however, but they have met with many people over their career whose medical situation was at an all-time low. None of our nurses have personally dealt with a patient's suicide, but I've seen many in the nurse community and on the news, the most recent being the young woman dying of the brain tumor who wished to take her own life. All nurses believe that the hospice plays a big role in allowing people to die with dignity and without suffering.
In most Western societies, the Judeo-Christian religious tradition has given great importance to the sanctity of life. The distinction between ordinary and extraordinary care has its origins in Roman Catholic moral theology, where it is employed to distinguish between obligatory care, ordinary, and care that may be permissibly forgone, extraordinary.